Once upon a time, there was a kind and handsome nurse named Amri from Klatte. He works as a staff nurse at a famous hospital in the entire universe called Haley Medical Hospital. He loved his job so much and has been working as a nurse for almost 2 years. And this is his story.
Hey, Mr. Hey, Mister. Good afternoon. I want to ask you regarding eating output. Can you tell me your eating output?
What? Oh, sorry, I don't know what you are talking about.
Wait, what? Seriously? You don't know what intake output is? How many days have you been warded? You don't know what is intake output?
Sorry, nurse. I don't know.
Oh my god, I'm tired of explaining. It's like, how do I say it? How many drinks you had today, and how many times did you go to the toilet? Oh my god, this patient again is very annoying. I'm so tired of him. Nina, can you check him for me?
Seriously, me? Hello, bro. It's not even my patient, okay? It's yours. Go check my lesson now.
Don't mind that, let me be. I want to finish my report early so I can go back home. Can you please at least check, turn off the problem?
Seriously.
Students, where are the students? You, the one with the blue mask, come here. What's your name?
Yes, staff nurse. My name is Aisha.
Okay, good. So now I want you to do dressing on patient bed 20, named Miss Linda, and afterwards come with me to do the medication, and then send the blood to the lab. Is that okay?
Okay, staff nurse. I'll do it.
Okay, great. And yeah, don't forget, I need your help to change the diaper of the patient on bed 12. Please change quickly, okay? Because the patient keep complaining. Ask your friend to help you. And I'll be at the pantry. Anything, don't call me. Yes, sir. How can I help you?
Nurse, can you help me? I want to go to the toilet, but can I use the wheelchair?
Sir, your condition is not too serious. You can walk your own, meaning that you can go to the toilet yourself. But I can come with you if you want.
Nurse, if I can walk, I wouldn't ask for your help.
Whatever.
Nurse, can you help me? Can you pass me the water bottle? I can't reach it because my problem is.
Come on, don't be such a crybaby. Move yourself a bit and stretch your arm a little more.
Nurse!
Yes, Nathan, do you need anything?
I don't want to receive. Can you buy for me instead? I feel like I'm ready for something like sweet and sour. I want you to go downstairs and buy me some fruits. I want it fresh and organic. Maybe some strawberries, I guess. If there are no strawberries, I don't want anything. I want it, and I want it until tomorrow. Then talk to sister about this.
Okay, Nathan, anything for you?
Okay. Take this card and buy for me now.
Okay, Nathan. By the way, I'm sorry to say this, but the hospital policy requires you to take those things off.
What? Excuse me. I can do anything I want. I'm nothing idea, okay?
Okay, sorry.
This is Sister Zarifa from Ganu. She had been watching Nurse Amri since the first day he worked.
Hi, sir. Are you okay?
Alhamdulillah, I'm okay. I feel better today. But can I ask you something? When can I be discharged from the ward?
Sorry, but the decision is on the doctor. But I'm sure that you will be discharged soon.
I can't wait for that time. Ya Allah!
Do you look so stressed? Do you have any problem? Maybe I can help you.
Well, it's not really a problem, but I guess it won't hurt to tell you. Actually, during my stay here, your staff has been mistreating me. I feel more sick and neglected. I just wish to go home.
Can you tell me more about it?
Actually,
Please, I understand your frustration and to make sure that your remaining days in the ward will be more enjoyable, and I'm sorry on my behalf of my staff.
it's okay, but I hope these problems won't happen to another patient.
Bella, come in. Well, so I heard that you have something to discuss with me.
Yes, sister. I want to discuss about Miss Amli. Sister, I think you should advise him on certain things.
What thing? About what things?
Okay, sister, like this.
Okay, I understand your concern. No worries, I will talk to him later. Coming.
Good morning, sister.
Good morning. Please sit down first.
Oh,
Camry, I noticed that your performance has been declining recently, and also I also received some complaint from your friends and also from the patients. So, do you want to explain yourself to me?
let me try to explain. The problem here is not me. The problem here is the ward. The patient, they keep calling me. And they keep asking me for my help. I try to do my best to help them, but they keep complaining about me, what? And then my co-workers, the other nurses, I asked for their help, but they don't want to help me. They even mocked me. They said that I'm too spoiled to work here. I'm sick of them. I'm sick of the patient. I'm sick of you. I'm sick of this ward.
Calm down, relax. We can talk about this. I understand your condition, Amri, but you have to consider your environment too. You as a nurse, you are a team, and I know that you have learned the principle for the caring for the patient. I know it's hard sometimes to be a nurse, but you have to stay strong. You know, right, that nurse is a noble job. If you do your job properly, you will receive a lot of reward from Allah. Try to imagine if the patient is your family and the co-worker is your sibling. Do you want to treat them like you treat them now? Okay, so please, Amri, I hope you can change for the better.
But sister, you don't understand me.
Over time, Amri's behavior has changed. He became more rude and rude to others. He fought and fought and fought. He even lost control of himself. He became selfish and lost empathy to others. He did not want to listen to others. He came late to work every day. He also talks back to the doctors and even to the sister ward. He lost respect for the patient and his colleague too. Oh no, what do we do?
Amri, have a seat. So I noticed that your behavior has worsened. So I have no choice but to give you a warning letter.
Alah, sister, come on. Okay, I promise you, I will improve myself. I'll fix everything. I need this job, please. Come on. I promise you, I will do better next time.
After being offered the warning letter 3 times, Amri finally had enough. He decided to change 180 degrees and became the superior Amri. He did not want to lose his job. He was determined to be a better person. He wanted to change for his wife and son. For the sake of his family, he was willing to risk everything and be a great worker. He became more kind and respectful and more handsome over time. He joined the counseling provided by Sister Zarifa with his his colleague. He also accepted others' opinion and became more open-minded. Alhamdulillah, he has changed. We all love Amri now.
Nurse manager are the key person responsible for assisting other nurses evaluate their moral commitments. They also have ethical requirement to lead, by example during both good and bad times. Nurse manager perform a combination of leadership tasks, administrating duties, and also direct patient care. They assign tasks to their nursing team and spend time to evaluating their behavior and analyzing their patient outcome to identify success and areas for improvement. They address issues like hygiene, infection control, and best practices for administering medication. Nurse managers spend time coaching nurse one-on-one and setting goals for their career growth. They facilitate communication between their teams and other staff such as doctor, order lines, administrator, and also custodial staff. They also analyze financial data to compare the budget to expenses and plan a new initiative. As a result, they are required to be capable of dealing with ethical concerns that arise.
In the scene shown before, there are some examples of problematic nurse such as rude behavior toward the patient, ignore the call bell, provide double standard service to different patients, and not being responsible to their job by push it all to students. Generally, there are 4 common problematic employee. First, absenteeism and tardiness. Absenteeism is any failure to report for or remain at work as scheduled, regardless of the reason. However, some cases may be sign for big problems such as unsatisfied with something at work or having personal crisis at home. Second, insubordination and uncooperativeness. In other words, disobedience and did not want to work in team. This type of problematic staff usually spending most of their shift with socializing, joking around, or moving as slowly as possible. Third, alcohol and drug abuse. Some of the symptoms may include poor performance such as unsafe practice, sloppy work, or frequent absence. And lastly, employee theft, which they steal or the use or misuse of various assets of a workplace without permission, regardless of the method used.
Okay, next I'll be talking about the causes of employee problems. Number 1 is still job responsibilities. One of the major reasons that employees' performance suffer is lack of self-motivation, which is usually most influenced by the work they do. An employee may become bored or disinterested in their work, especially if they have been doing the same job before. Number 2 is class rewards. Many employees are motivated by rewards but consider whether the rewards you offer are meaningful enough to motivate high performance. For example, do employees feel that they have a good shot at receiving an incentive? If funds for incentive or pay increases are traditionally low and reserved for a small percentage of employees, they may believe that the rewards are not worth the extra effort. Number 3 is inadequate training. Sometimes employees just haven't had the right training or skills to do their job effectively, and this gets overlooked in the hiring process. We may find that they don't know how to do their job or parts of their job. They may have gaps in experience or knowledge that prevent them from performing well, or they may have been scared or ashamed to admit that they need guidance to do certain tasks. And the last one is personal problems. Many workplaces have the philosophy that the employees should leave their personal problems at the door, but we all know that they seep into the workplace and affect performance. Childcare issues, parental problems, critical illness or injury, and life changes may be unavoidable. Lead to performance and fitness problems for our.
Okay, there are some strategies and also guidelines to handle problematic staff. Okay, for first minor misconduct, nurse manager can just give informal talk to the staff. For first misconduct or second minor misconduct, first formal warning, which is verbal, will be given to the staff. For second misconduct or third minor misconduct, first written warning will be given to the staff. And for third misconduct or fourth minor misconduct, final written warning will be given to the staff. And for last one, major misconduct, which is the last process, can cause dismissal. Okay, as a nurse manager, the way you handle problem employees influence your team's performance as well as the respect you get from your staff. If you don't address misbehavior promptly, you risk undermining your authority. In addition, if one difficult nurse is permitted to push the boundaries or mistreat patient or fellow nurses, this could compromise employee morale and patient safety. Be clear about what you will and will not tolerate, while also demonstrating respect. Okay, first of all, as a nurse manager, what we should do is we have to set firm boundaries. Make it clear you won't allow difficult behavior from your staff and that you expect employees to treat you with the same respect you give them. If a nurse raises her voice and the conversation, don't interact with her until she's ready to calmly continue the discussion. She will realize that she can only make progress if she behaves civilly. In addition, you will demonstrate that you won't accept disrespectful behavior from employees but are willing to hear them out if they conduct themselves professionally. Okay, next, as a nurse manager also, we have to limit our interaction with the staff. Don't engage in a lengthy conversation with a difficult employee. The longer you allow her to make demands, the less authority you have. Don't give her a chance to question you. If you must give her instruction, keep the conversation brief. This show her that you have the final say and that she can't get her way by causing trouble. Okay, next one, as a nurse manager also will have to understand our staff perspective, and employees' difficult behavior might not be deliberate. She might have trouble coping with stressful situation. This could cause her to act out in unprofessional ways. While you shouldn't condone this behavior, take a moment to see where she's coming from before you take action. You might discover that she doesn't need punishment but compassion. Her negativity could trouble her as much as it does you. And if you acknowledge her anxiety and show empathy, you could diffuse a potentially volatile situation. Okay, for the last one, as a nurse manager, will have to handle the problem privately. Reprimanding a nurse in front of others can make the problem worse by making her feel singled out in front of her peers. If you must take disciplinary action, also criticism to the staff, meet her with her one-to-one. If you want a witness, ask a fellow nurse manager, not another staff nurse, to sit in on the meeting. The employee might be less likely to be defensive if she doesn't feel the need to save face in front of her colleagues. Next, the most appropriate leadership style in this situation is democratic leadership. The democratic leadership style welcomes and encourages input and communication from the team when making decisions. Relationships are highly valued by this type of leader, and it is important to them that their teams feels comfortable and willingly to voice concerns, opinion, and also ideas. A democratic leader also sees value in providing feedback to their team, truly viewing communication as a two-way street. Okay, there are some pros of democratic leadership style. Democratic leadership in nursing can work well to ensure the team feels valued and comfortable speaking up. High reliability organizations value transparency and input from team members with the most expertise, not necessarily seniority or highest rank, making this type of leader beneficial in creating a culture that promotes input from the entirety.
When I get down with you,
And 1,000 times I've seen this road, 1,000 times. I've got no roots, but my home was never on the ground. I've got no roots, but my home